Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Probenecid. Its brand name is Benuryl. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Probenecid. We'll then touch on examples of dosing, and then finish it off with side effects. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Probenecid can be used for anti-gout measures. So in this case, Probenecid is a uricosuric agent. By competitively inhibiting the active reabsorption of urate at the proximal renal tubule, it increases the urinary excretion of uric acid. It can also be used as an adjunct in antibiotic therapy. So this medication is a competitive inhibitor of the secretion of weak organic acids, including penicillins and some cephalosporin antibiotics. So it therefore increases the concentrations of these antibiotics. In terms of indications or reasons we would prescribe Probenecid to a patient, well, we may see this medication used to treat hyperuricemia associated with gout or gouty arthritis. As well, this medication may be used as an adjunct in antibiotic therapy. With respect to contraindications or reasons we would not be able to prescribe Probenecid, well, first of all, we wouldn't give this medication to a patient who had a hypersensitivity to Probenecid or to any other components of the formulation. If a patient had blood dyscrasias, they would not use this medication. As well, patients under the age of 2 years old would also not use Probenecid. This medication would not be used to treat an acute gout attack. It would also not be used in the treatment of uric acid kidney stones. Now for some examples of dosing with Probenecid. So when this medication is being used as an adjunct for antibiotic therapy, we may see 2,000 milligrams per day given orally in divided doses. When it's being used to treat hyperuricemia associated with gout or gouty arthritis, we may see 250 milligrams orally twice daily for 1 week, followed by 500 milligrams orally twice daily. After this, the titration will be 500 milligrams every 4 weeks, and the maximum dose would be 2,000 milligrams per day. As with all medications, there are some side effects or adverse reactions that patients may experience while using Probenecid, so we'll go over some of those here now. Some patients may experience a loss of appetite or dizziness. Others may experience vomiting or a headache, and some patients may experience sore gums. Frequent urination is also a common side effect with this medication. Some more rare but serious side effects would be Stevens-Johnson syndrome, hepatic necrosis, or a hypersensitivity reaction. Alright everybody, that's all we're going to talk about today with Probenecid or Benuryl. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.